So body calibration is a modality that I've created over the past 5 years. My first year out of massage school, I did the typical like lotion, deep tissue style of approach on manual therapy. And once I moved from Phoenix to UFC gym here in Fort Worth, they didn't have a room, but I knew that I could still do something with my hands, right? So I just put out my table and started doing more of a dry approach. And over the past 5 years now, I've really focused on the dry approach. And every time my clients would ask, like, what is this called? Because it's not a regular massage, it's not deep tissue, it's not specifically trigger point. My response when they ask what is it, what's the name of it, I would just say it's a melting pot of the past 10 plus years of my knowledge. And finally now I've named it Body Calibration, because I feel like I go in and if someone's shoulder's hurting, I go and kind of recalibrate the whole shoulder chest area and not go for a deep tissue massage where they're so worried about having to cover the whole landscape of the body, where I could just cover the chunks and dig in really deep. So for body calibration, the tools that I use are the rock tape line. One of them is cupping, which they call the rock pods, and that's for decompression of the fascial layers, and it's not literally bringing the blood out like the heated glass ones are. These are meant for fascial shearing and just a little bit of blood suction towards the skin layers. They also have IA stem, which is instrument-assisted soft tissue mobilization tools, which are, they call them rock blades, and they're handheld scrapers that you go along the body trying to get into knots and break apart fascia layers in different ways, just in case the cup alone isn't going to tear away a dysfunction or an adhesion. So then you get the blade, you scrape along, and you're able to get that adhesion and pull apart. And then they also have taping, kinesiology taping. That will actually help to decompress layers after the work is done. I like to apply the tape to help keep it almost as a sling or a brace. It's kind of opposite of a compression sleeve, where if you put on like an elbow sleeve, that's actually going to squish all the layers of the muscles and fascia together, which may cause more adhesions. And the kinesiology tape will actually help lift it and allow the fascial layers and muscle layers to slide independently how they should. So for the first time, I listened to the pain symptoms, and then I ask a body movement or some kind of body pattern, and I try and find it. That way I'm actually trying to find the source of where everything's bunching up, because fascia, when it tightens up, it starts to pull from other areas of the body. So if someone's telling me that they actually have migraine headaches or tension headaches, I look at their stance, I ask how they sleep, I ask what kind of patterns they do at work, things like that, because for example, if that tension headache is coming and their shoulders are rounded forward, right away I'm going to want to open up the chest before I even touch the neck. I could have someone who will come in for typical soreness or maybe a common overuse injury, and they could go once a month for a little while and then they feel good. And then I can have someone with a full knee replacement, and I'm going to have to open them up once a week for about a month and then taper off from there. It just depends on what's going on with their body and how much trauma is actually done to the tissues. To better understand my modality or get eyes on it, you can follow my Instagram. It's at Mike_muscle_mechanic. So that's Mike Muscle Mechanic with the underscore.